Hi, I'm Jen Downs with this week's Martha Jefferson Monday segment. With the summer months coming around, the weather's getting nicer and people are outside more. It's good news, but it can also mean more injuries. We came to Martha Jefferson Orthopedics and spoke to Dr. Steve Hoover about the most common hand injuries he sees. The sun's out and many are jumping back into action after winter, but getting out on the court or activities like skateboarding or rollerblading could put you at risk for a hand injury.
Fall on the outstretched hand is the most common way to fracture the bones in your wrist.
Dr. Steve Hoover with Martha Jefferson Orthopedics says being active does come with risks, and fractures are the most common type of injury he sees. Sometimes the injuries need immediate attention.
If someone notices immediately that there's deformity to the hand or wrist, a great deal of swelling, tremendous pain, anything like that, their intuition tells them they really need to be seen on an emergent basis, I think they should follow their intuition.
In other situations, patients may monitor swelling and pain themselves to see if it gets any better before calling the doctor.
I think that's reasonable. It's rest, ice, take it easy. See how things go over 24 hours.
If you do find yourself in need of a doctor for a hand injury, Martha Jefferson Orthopedics does take same-day appointments. They can be reached at the number you see on your screen.